Hi team, so I wanted to do a quick post here about a study that's been doing the rounds the last couple of days, which you've probably seen, the DIETFITS study, or some results that have been published from the DIETFITS study. It was a pretty big study of 609 participants, so that's a very big intervention study. You know, when we see very large numbers involved in studies, they're typically prospective cohorts or they're observational studies of some type where they're looking at what people eat versus the outcomes that they have without prescribing an intervention per se in most cases. So this was a very big study when we look at actually applying a dietary intervention. So as I say, it was a study of over 600 people, a big study with the participants between 18 and 50 years old, a mean age of 40, and the participants were overweight to obese, non-diabetic, and they were randomized to either a healthy low-fat diet or a healthy low-carb diet. Now, interestingly, in this study, they also investigated insulin status versus outcomes and some genes associated or that have previously been theorized as being associated with a propensity towards a low fat or a low carb diet. So they looked at some genetic factors and insulin status as well to see whether there was any difference there. Interestingly, one of the first things that I saw when I looked at the study was the 12-month mean macronutrients. So in other words, over the 12 months on average, what were the participants in these groups eating? And when we look at the protein intake between the groups, the low-fat group was eating around 21% protein. The low-carb group was eating around 23% protein. So there's really no difference there. In carb intake, the low-fat group were eating around 48% calories from carbohydrate, and the low-carb group were eating around 30% calories from carbohydrate. So we could probably debate until the cows come home whether 48% calories from carbohydrate is really high carb, low fat. And similarly, we could debate whether 30% calories from carbohydrate is a true low carb diet. Now, I'm not going to get too much into that because that's always a common debate. You know, low carb people will often say in any study, well, the carbs weren't low enough. You know, often high carb people will have similar sorts of debates. So let's not get into that too much, but it certainly is a consideration, right? We don't always want to come to these studies and say, oh, well, this wasn't high enough, this wasn't low enough, but it's worth looking at what that actually means if we're applying this clinically. The fat intake in the low fat group was around 30%, which would be considered to be a sufficient fat diet, particularly for performance and things like that. Whereas in the low carb group, it was around 45% calories from fat. So on balance, we wouldn't necessarily consider the low-carb diet to be ketogenic in terms of ratios, although when we look at the absolute amounts of carb intake, which we'll talk about in just a sec, then it could well be that some of those participants were in ketosis, but that's a bit of an aside as well. In terms of results and a summary of those results, the weight change was practically the same between both groups over 12 months. So there was a mean change of 5.3 kilos for the healthy low-fat group versus 6 kilos for the healthy low-carb group. So although there was a very slight benefit in mean weight loss over 12 months, I mean, it was very little. It was 700 grams, and it wasn't a statistically significant effect. So really, we would say that the weight loss was exactly the same between groups. There was really no interaction between genes and outcomes, or that insulin secretion or insulin status and outcomes either. There were the adverse events between both groups were basically the same as well. They were evenly distributed across the two groups, so we wouldn't say that either diet promoted more adverse effects. So let's drill down a little bit more into the diet design. The participants in these diets reduced either total fat or total carbs to 20 grams per day for 8 weeks. Then they added fats or carbohydrates back into their diet in increments of 5 to 15 grams per day until they reached the lowest level of intake that they believed they could maintain indefinitely. So they basically went on what was quite a very low fat diet or a very low carb diet initially, and then titrated their dose of either carbs or fat, depending on their group, back to a point at which they felt they could maintain the diet, which is a pretty cool way to do it. And in many respects, that mimics the approach that I take in the carbohydrate appropriate diet, where you can start with a very extreme restriction and then add carbohydrate back, or start more moderately and titrate the dose down. So a similar sort of methodology there. One of the interesting things is that this is really a study on healthy diets, which is cool. The recommendation included to maximize vegetable intake, to minimize the intake of added sugars, to minimize refined flours, trans fats, and to focus on whole foods that were minimally processed, nutrient dense, and prepared at home where possible. And I feel like doing a hat tip there to my colleagues up at AUT when we created our alternative set of dietary guidelines, which really focused on a qualitative approach to nutrition. In other words, eat real food and eat it with friends and family. But it was a pretty cool study because it wasn't comparing a crappy diet with either a good low-carb diet or a good low-fat diet. It was comparing two good, healthy, nutrient-dense diets, one of which was lower in carbohydrate, one of which was higher in carbohydrate. There was also behavioral modification strategies used. So there was counseling and support that allowed for people to adhere better to these diets. So this is an interesting aspect of the diet too, because both groups with support achieved similarly. Now, I would say that that's an interesting confounding influence too, because we need to look at, without the degree of support, would people achieve the same whether they're on a lower fat or lower carb diet? And there seems to be some indicative evidence, which I don't think this study has refuted, that those people who are insulin resistant or have worse insulin status at baseline might adhere better to a lower carb diet. So that's still something I think that needs to be considered. The insulin testing measurements were interesting, and that they took a 30-minute insulin test at baseline in 30 minutes after having an oral glucose tolerance challenge of 75 grams, which is a very common way to assay insulin response. Now, I'm not an expert in that space, but Catherine Crofts up at AUT, one of our colleagues, has done a lot of work in that area. And it may be that there are nuances within that as well that need to be investigated further. Now, I'm not saying they are going to show anything incredible, but it's certainly worth continuing to look down that route, because people's insulin responses to carbohydrate are quite different, and we see quite different curves of insulin response over a period of time after a high carb meal, depending on the person's baseline insulin status. So we can't necessarily just look at a snapshot and say, well, this person's insulin resistant versus insulin sensitive, because there's a little bit more going on than that. So while the study showed that there was no real effect of insulin status at baseline on outcomes, there might be some subgroups for which there are differences there. One thing that is also interesting here is that the exceptions might muddy the waters of what we're actually seeing. Now, it was a study on what I'd consider to be relatively healthy overweight volunteers. In other words, the exclusions from the study might actually be some of the people who benefit most from a lower carb diet. For example, the exclusions included hypertension, metabolic disease, diabetes, cancer, heart, renal, or liver disease. So we're really looking there at some of the conditions that we would typically prescribe, perhaps in a clinical setting, a lower carb diet, because the results that we see clinically tend to be better from that. And also, obviously, we're looking at the adherence and compliance aspects for that as well, which are obviously critically important. I'll reiterate as well, was it really a low carb, low fat intervention? I mean, it was certainly lower carb and certainly lower fat, but like I said, the interventions were pretty modest in their changes. When we actually look at the absolute amounts of carbohydrate that we're eating in both groups, there was a mean intake of 108 grams of carbs per day in the lower fat group versus 63 grams of carbs per day in the lower carb group. So, I mean, they're both modestly low carb diets anyway. And so what we might actually be looking at is a fairly small difference or no difference in outcomes between two lower carb diets that were based on a very healthy foundation of food. So, that's a good thing to see, because what it shows is that even modest restrictions in carbohydrate promote outcomes. There were also some minor differences though. There weren't any differences obviously with weight and the main outcome measures. There were significant differences though in a couple of the blood lipid measures. HDL was improved significantly more on the lower carb diet. LDL increased significantly more on the lower carb diet, and triglycerides were reduced significantly more on the lower carb diet. So if we consider that clinically, we would look at triglycerides as being one of the key indicators of cardiometabolic dysfunction and a potential risk factor for later disease, then that was reduced more and significantly more. So it showed statistical significance on the lower carb diet. Similarly, HDL with its protective functions is pretty important, and so that was increased significantly more on the lower carb diet. And there was, as we'd expect, as we often see, a small increase, a significant increase, a small significant increase in LDL in the low carb group. But like I say, we'd expect that. And in studies that have broken down the lipid subfractions associated with that, we find that there's really no problem there. So there might be a very minor benefit from a lower carb diet in respect to lipid outcomes and things that are indicators of cardiometabolic health. So overall, where does that leave us? And I think what we see from this emerging in amongst all the other evidence that we see is that a healthy diet that you can stick to that allows you to eat ad libitum, in other words, eat as much as you desire, but that still allows, in eating as much as you desire, for you to not eat excessively and to not go over the amount of calories that you require, is the best diet for you. So basically, if you can eat to satisfaction, a diet that contains good, natural, healthy foods, and you can adhere to it over a long period of time, that's the best diet. Now, for some people, that's going to be low carb, and for some people, that's going to be low fat, and for some people, it's going to be the extremes of that, 80-10-10 for some people, or a ketogenic diet for some people, and most of us are somewhere in between. So really, it comes down to finding your balance, but the first port of call is always a qualitative port of call, not a quantitative one. It's always eat a natural, healthy, whole unprocessed diet that's incredibly nutrient dense and has a shit ton of vegetables. So I guess at the end of the day, this is just another study which shows that a carb-appropriate diet is the best diet for you. And that could be quite different depending on exactly who you are, what conditions you have, and what your desired outcomes are. So I hope that sheds a little bit of light on this. I'm going to post this up in my Patreon account with a few links to some other really good analysis of the study as well from Brad Dieter over at Science Driven Nutrition and the guys over Examine.com who always do an awesome job analyzing this kind of stuff or summarizing this kind of stuff, and also a link to the study itself. So hope that helped.